Big thing would be also to look first about the stress, so other things that are not necessarily food related that might be affecting the levels. Their sleep quality, are they, getting enough hours of sleep? Are they going to bed early? Those factors would be important. Hydration is another factor too. Sometimes I've found that people that are chronically dehydrated will have higher numbers sometimes in the morning, but usually at night. So if people are eating late at night, like their dinner's late, it will usually affect their blood sugar if they're having higher fat meals, because fat takes a longer time to be digested. It takes about 10 to 12 hours. So as your body's breaking down that fat, then there's that rise naturally from the breakdown. So I'll see that, people are eating like a steak at night or pizza or something. Their numbers might be fine right after the 1 hour, but then in the morning time, it's much higher. I usually incorporate in like a 10 or 15-minute walk after dinner. That tends to help as well. And then sometimes like around a 15-gram protein snack about an hour or two before you go to bed, something easy to digest, like maybe like a Greek yogurt, for example, that won't affect your sleep quality, is a good snack to have. But I have women that'll be like, well, if I get up in the middle of the night and I have some ice cream, I heard that helps me to lower your fasting. I'm like, why would I tell you to get up, from sleep, eat, and then go back to bed for it? Because your fasting really is a true measure of like an 8 to 10 hour fast at least overnight. So I think that's a misconception that I get a lot of times from women. They hear it from a blog or somebody else that went through it. But remember, everybody's a little bit different. So sometimes, what might work for one woman may definitely not work for another one. And then there's, after we've kind of exhausted some of those strategies and it's still high, then that's time to talk to your fetal medicine and doctor about incorporating insulin in to help lower the fasting number too.
Fasting is, I think, some of the hardest glucose levels to treat. And, you can't always diet and exercise around it. And sometimes it's just your baseline physiology. So starting medication isn't a failure, that word that keeps coming up again. It's just supplementing what your body needs because of the growing insulin resistance in pregnancy. So once you've made the diet changes and you're having a bedtime snack, not over fasting, because if you go for longer than 10 hours, you can have some rebound in your glucose numbers. If you're doing all those things, it's not that you're doing something wrong and still elevated. It just means that your body needs a little bit of help. And that's when your team can step in and help you with some insulin to help bring that fasting number down. And sometimes once patients start that fasting or that insulin to bring down their fasting number, I feel like their stress also gets a little bit better because they're so worried about, well, maybe if I try this for my bedtime snack, or maybe I'm not doing this right, and they're trying so hard to bring it down. But it's just your body physiology